it cannot see. It's going to miss that one. Then, meanwhile, we have the CNN, Convolutional Neural Network, which is the industry standard for image analysis. So this is going to detect patterns, nuanced patterns in the forms into the human eyes. So mix these two models together, they are going to find patterns that the humans can't see, and they are going to scale efficiently to screen thousands of patients, thousands, millions of patients instantly. It's not going to take a lot of time, and it's going to deliver objective, data-driven results. So that is why we propose this particular solution. So thank you. Franklin, you can for the next person.
Okay, good evening, judges. Our product aims to reduce the cost, especially the ones that are tied with targeting reduction in late-stage intervention by shifting the care upstream to cheaper and preventive measures. We're also going to improve the efficiency of the hospital system by reducing the time that ECG specialists use to review these test results by about 30%. And hence, there will be more patient throughput that will allow the specialists to see about 15 to 20% more complex patients in the same time period. It's also going to enable us to increase the revenue or save revenue by offering capture a new target market share by offering new cutting-edge technology that will also provide efficiency. We're also going to improve insurance quality metrics tied to preventive care, because employers spend a lot of their yearly medical budgets on about 20 to 25% on cardiovascular disease. And the ultimate goal of our technology is to save lives through early intervention and proactive care. So all these tied together are the financial or the ROI that the board of directors are supposed to expect from these products. Francis, please, next one. Franklin, please, yes. Our projects are going to leverage data from high quality and publicly available medical data sets that has already been explored and validated. We have about 500 plus ECG images from Cargo and about 70,000 patients' medical records. These vast amount of data will allow our model to be more efficient, and we'll be able to better predict these outcomes. Our data set for the tabular data, we will remove the outliers, and continuous features will be grouped into bins to create variables. Then additional features such as map and BMI will also be engineered from these existing variables that are present in data sets. For the image data sets, our data augmentation techniques will be applied to increase variability and improve the robustness of the model. Then for tabular data, we will apply smooth to address class imbalance through sampling. Then for the model validation, we would be splitting the data sets in the ratio of 80 to 20, and for training and testing. And then model performance will be evaluated using F1 score to ensure a very good balance between precision and recall of the model. Thank you.
Okay, thank you so much. So from our plan, if we could look through at the roadmap, we are going to start with the phase 1, which is data preparation, which will last for week 1 to 4, where we are going to do a cleaning, pre-processing, features and engineering, and data augmentation. So it also includes using pandas for cleaning, and also scikit-learn for handling missing values, and also creating variables like body mass index, and also mean area pressure. Then image augmentation, we're going to be using textile flow as well. So this will help us have a clean model. So the next phase we're going to do is to prototype and validation, which is going to cover for the week 9 to 11th. We'll build a dashboard that integrates the entire model and validates with pilot group of cardiologists. cardiologists. So this involves the models like the CNN, which will help us to train these ECG images, and the XGBoost for also helping us to research and cross-validate the accuracy across board. Then the last, this next phase, which is pilot and launch, we're going to work with selected 2 clinics that will help us to validate our work, give us feedbacks that we'll use to inform us to make model improvement. Please, next slide. So on the clinical adoption trust, we are going to follow 3 steps, which is risk assessment and for mitigation strategy. One is to develop the specialist dashboard with the pilot group. So from the hospital to clinic we are selected, we'll have a cardiologist that we're going to work with that will give us feedbacks that we incorporate. And we are going to use the explainable AI. The explainable AI technique will help us to know how the models are making predictions as well. Now, the second risk we're looking at is regulation and ethical compliance. This is going to ensure that everything's aligned with the legal framework, and also using clinical decision support, which helps health providers to make decisions. Then the next risk we are looking at is patient model accuracy. This patient facilitation to represent results as risk level with clear disclaimer urging consultation, not as a medical diagnosis, and also validate against historical outcomes. Next slide.
The resource requirements for success: the people core team, data scientist for our team, data engineer from the IT for data pipeline, FTE clinical experts, cardiologists for domain guidance, FTE UI and UX designers for the patients and special dashboards, technology for the tools that we'll be using to have access to a secure cloud environment, AWS, GCP, Azure, and GPU, instances for the CNN training. We'll also work with a budget of $10,000 for potential external validation datasets, API costs, access. We have only read-only and anonymized access to the cardiology and patients' records. Go to the next slide.
Okay, apart from what we are actually seeking for your sponsorship and approval to initiate the 14-week Cardio Shield AI project, beginning with phase 1 data foundation with a total resource asked as applied. The immediate next step upon your approval, our immediate next step is to convey the core team and our clinical expert to formalize the phase 1 data protocol within 1 week. So we are showing you that this project will actually be a breakthrough in medicine. So we need your approval to get all these things done, and it will really benefit medicine and everybody involved. So thank you for listening, and we hope that things get released on this thing.
Okay.
All right, thanks, guys. Good pitch. Should I, do you want to start, or I'll start? I've got a couple of questions written down.
Go ahead, Ben. Go ahead and start.
Okay, go ahead. Okay, let me go ahead. So just to start, guys, thanks for your presentation and good speech. I've got a few questions, and I'm going to ask all of them at the same time. So I'll ask that you guys take note of them, and then you come back with a response as we speak, okay? Just so that I wrote down, say, okay, how much of clinical data and personal health data is publicly available? That's number one question. You probably might not know. Even me, I don't know. So I'm just asking. So I want to know how you gather your data. How much of health data is publicly available? Second of all, how do you handle, I did not see it in your presentation, how are you going to handle data protection policies, global data protection policies, and probably local data protection and data sovereignty policies and regulation that is global? How are you going to handle that? I didn't see that in your presentation. That's number 2 question that I wrote down. I have so many questions, but let's just keep it to 3 and then we can go. But it depends on your response. Your response will prompt more questions. That's how sometimes we roll. And then the 3rd question is, okay, now it's going to be 4. I didn't see anything with regards to responsible AI, because this is you bringing AI to answer question. I didn't see anything about responsible AI. We talked about at some point, your AI need to be responsible and ethics of AI. We talk about accountability, transparency, and all of those stuff. I didn't see that mentioned on your pitch. And I like money a lot. So I saw somebody ask if we can give you an approval to start the project, and in 14 weeks you will deliver. And it's going to cost you $15,000 to deliver the project. What is the return on investment? If I give you $15,000 today, how much are you going to give me back over time? And how are you going to give me back that money? What is the return on investment? And what is the process to get those return on investment that you will put? So these are my 4 questions. And trust me, I probably would drill a lot more if your response isn't good enough for me. So you can answer it within yourself. You can pick within yourself. Or do you want Sean to take his own questions so you answer all of them once? Or Sean, how do you want it to roll?
Oh, why don't we answer these questions, and then I have a couple
Okay,
comments.
good. Let's go. Answer mine first.
Okay, thank you very much for those thoughtful questions, Sabian. Regarding the data set, the data set, we know that medical data sets are hardly made publicly available, right? But because we are doing a small scale project, right? We had to just look for synthetic data sets. The data set that is available at Cargo, the data set is not it's not real, right? It's synthetic. So we are using synthetic data sets, and because we are not yet we don't yet have the capacity to access these private hospital and patient medical records. Yes, that's for the first question. Then the second question about data privacy. I think my group, any of my group members can answer that. I will leave that to Avis.
Sorry, I'll get back to you on how we're going to handle the data privacy of the patients in a minute. I'll get back to you. Sorry.
Fair enough. Okay, someone wants to help.
Yeah, while I was doing research, I heard about homomorphic encryption, where the models can actually process this data without ever actually seeing the data, because they will be encrypted. And we do need to decrypt the data before the models be able to use this data for prediction purposes.
Okay, go on.
Okay, regarding the next question, you mentioned about the ROI, the return on investment. We are demanding $15,000. This is based on what we just agreed. We just decided that $15,000 would be a good one for us to implement this project.
So there is no science behind the 15,000. You just agreed and you put in $15,000.
There is a science. There is a science. Considering we just made a research on the cost of implementing of creating a website, of creating an app, of integrating it with the hospital system, the cost of API, because API, when free API have their own limits, the cost of GPUs. So we just made research, and we just added up everything to get $15,000, and consider our ROI, we're looking at three times the capital investment.
I didn't see that on your presentation. That's what I mean. I didn't see all of this breakdown or something about that. So if you're looking at an investment, I remember Steve was saying that give us approval, let us go and do it. If you put in an investment and you're putting a cost to the investment, you should be able to put a slide that shows the return on that investment and how long it will take for that return to happen. I know I saw your timelines of about 14 weeks or thereabout. Okay, that's it for me. Let's not keep questions. We should be able to grade with this. And then, Sean, over to you, man.
Sure. Thank you. Thank you all for this. This is a wonderful presentation. I appreciate it. I do have a couple questions where I missed a few things. In the beginning, if the first presenter that talked about the actual elevator pitch, if you could just bring that slide up. So what I missed was, I understand why you're doing this, right? But I wanted to get a little more information as to that part of it. The second presenter that talked about the business problem, I saw that there was some information around the accuracy of the ML model and then being able to boost it as well. And I'm not sure I saw, what is the human accuracy today? Do you have a figure on that, or did I miss that?
Okay, yeah, we made research and we found out that the human accuracy is efficient by 40% compared to AI models. That's what we found out from research.
That's what I was thinking. It would be fairly low. So 86 is really good in comparison to what people can do. There's a young man at a university, and I follow his YouTubes. He used some Kaggle data and it was a cancer set, and it was labeled data, and with 30 parameters and 500 rows of data. And this is all simple Kaggle data. Could come from Nanda. He showed that he could build a model, and much like you in a subsequent slide identified, you'd use the 80-20 rule for the training set versus the actual test set. He was able to come up with a 96% accuracy, which is fantastic. And so what I've found in doing this, and I used to work with Stanford on rare childhood diseases and retinal myopathy, is and this is an interesting data point I'm going to share with you from an ROI perspective. For every dollar spent on machine learning and AI, there was 150-fold patient returns. Right. And so the feedback I want to give you is there's data out there. There's plenty of data. The why would you want to do this? The business problem is easily identified because it's a massive increase versus what's there today. The Vivian presented on two areas, the roadmap, data prep, data model, prototype validation. What I wanted to offer back is in the work that I do with customers, I tend to suggest a crawl, walk, run approach. And the prototype and validation pieces you have is together, and I usually separate those. And the prototype part is essentially follows this path. You're moving from focusing on value, which is your first set of slides in the discussion. The prototype, what it does is it validates the idea has market acceptance. Internally, that means user adoption. Externally, it means customers that are willing to buy something. And my advice is when you build a rapid prototype, it shouldn't take more than a week, and it shouldn't cost more than $100, because you don't need APIs, keys, licenses. You don't need proper data. You don't need to clean the data. And this is going to be a little bit of a different perspective for you. Maybe you don't need to clean data. You don't need to have clean data. You don't need to have sanitized data. You don't even actually have to worry about responsible AI yet, or data sovereignty or data state governance until you get ready to go into production.
Yep.
Right. So at this point, you can do very low cost things very quickly to validate that. You focus on the value first, which you did. Then you look at how do I prove that there is a buying customer? And the key is you have to have skin in the game. They have to have an investment of some sort, $1, time spent, endorsement of the idea, right? And then you move into validation, which is the technical validation to the equivalent line of business folks, the doctors, whoever's going to be giving you money later on to say, yeah, this makes sense, right? There's a wonderful body of work around how to build a rapid prototype by a fellow named Alberto Savoia. And he writes about building the right it before you build it right. Your idea has to make sense first, and it has to have market acceptance. Right, that's the feedback I wanted to give you. I agree with Ben on the 15K for APIs. There's lots of people that are going to give you free access to things. All of the major suppliers. Google will give you Colabs, AWS and Microsoft will all do the same sort of things.
Yep.
And you can run prototypes free on GPUs, right, or CPUs, and it just takes longer. So the other bit of feedback, and this is the part I want to mention about Vivian, the risk mitigation portion was really nice, right? And it's nice to validate against the concerns that doctors have that AI systems are going to somehow substitute their value, right? And when I talk to doctors, what a lot of them tell me is that they see this as validating their work. And so the doctor can come in and say, yes, that result looks right. And so their job really shifts a level up rather than competing with the AI. And Winner, I hope I'm not going too long. But this is really, really good. I'm really impressed with the team. Thank you for sharing this work. And I'm hoping that this is a real project you're going to move forward with.
Exactly. I was going to talk about that. This is not just you guys presenting this. I think it's something you want to go ahead with. Go get some doctors, go get some conversations. And trust me, I'll say it here, all right? If there's some form of help that you require, feel free to reach out to Winner. Winner knows how to get to me or probably get to Sean, and then we can support with how you make these projects live. So you're just doing this for doing its sake. I want to believe that it's something you want to work with afterwards. Stick to it, work with it, put the skin in the game and see what comes out of it. And then that's how you go.
I'm going to make an offer that I don't normally make, but this is...
Here you go.
Winner, thank you for inviting me to this. So I mentioned I work with Stanford. There's 2 doctors I'd recommend you connect with. If you're on LinkedIn, reach out to Russ Altman and reach out to Ewan Ashley, who worked closely with Google. One or more of them went to Google and I think may have left, and that they're closely associated. And they were the folks that worked on rare childhood diseases, and Ewan's team, somebody else on the team, worked on the retinal myopathy item I mentioned. And if you can reach them, great. If you want to use my name as leverage, great. If you want me to make an intro, I'm happy to. And what you can do is you can bounce ideas off of them and give them this presentation in essence, right? Here's the problem we're trying to solve. Do you have any guidance for us? I would recommend that. And then find others like them.
Yeah.
So thank you. Thank you for sharing these wonderful ideas.
Thank you very much.
Thank you very much.
Thank you very much.
All right. We all drop and join the meeting.
No, I'm not sure I understood that.
No. I'm talking to the group. They need to drop.
Okay.
Oh, okay. The group needs to leave now. All right.
Thank
cheers,
you so
guys.
much.
Thank you for your
Bye,
time.
guys.
Thank you.
All right.
Thank you so much.
Thank you.